Let me get that other deck up if you don't mind. 2 weeks ago, when Mitch was here, as you remember, a couple of things that he touched on. However, we're totally switching course today. While she could speak about all those subjects, this is the first session of the special topic series that we talked about very briefly at the beginning of the semester. That series is going to be focused in on industry disruptors, because while you're learning about the entrepreneurial mindset and the factors for success, it's important to grasp the context that you're doing all this within and to get some examples of the people who have come before you who are shaking up the world as you know it. That's what she's doing. She spent 25 years in healthcare and the life science industry. She was the CEO of a healthcare startup. She's led multinational research corporations. She studied biology here at U of M before she went over to Boston and Boston University in the late 90s. She worked at Boston Children's Hospital with the NIH. She's been named a top woman in health, wellness, and beauty, and one of the 50 most influential leaders in pharmacy. She lives and works by the mantra of talk less and do more. God, you have to love that. It's just so simple and so clear, right? In 2021, one of the largest retail pharmacies in the world hired her immediately after it told everybody it was going into healthcare. They hired her because she is the person to come disrupt that industry and to change the status quo. Please help me welcome Ramita Tandon.
So yeah, look, I came to Ann Arbor with the aspirations of pre-medicine biology. I studied biology thinking I was going to go and become a doctor. And, I had the fortunate pleasure of just working with a number of, professors and my peers and other mentors along the way. And I will tell you, just, after I left Ann Arbor and moved to Boston, it was what next? And so what I just would love to talk to you all about is that, I think, and what I've come to learn is that your journeys, your personal journeys, are not linear. And you are going to go through ups and downs. You are going to explore and find new opportunities to help support what you're passionate about and what you're interested about. And so, when I left Ann Arbor, I moved to Boston to pursue at the Boston University School of Public Health and Medicine, very focused on health administration, policy, and looking at the different parts of the healthcare ecosystem. While I was in school, I started to work in the academia route. So I was at Boston Children's Hospital, I was at Mass General, all the big Harvard hospitals, working on the research side as I started to work with the NIH and other government agencies to bring grants and really started to lift up the institutions that I was responsible for. And what was interesting, loved the work, but I got bored. And I was actually attending a conference, and I was talking to some folks in the industry, and they said, have you ever thought about coming to the industry side? And I said, no, because during my collegiate years, it was all about being in biology, science, being in the lab. Never thought of myself doing anything outside of all of that. And I said, listen, I don't know if I have the right skill sets or the right core competency to be able to transition into industry. And so, as I reflect back and I think about being part of the mission community, we're very lucky. You're part of a community that's diverse, not just in race, in gender, but also in diverse thought, an environment that supports different disciplines. And when I moved to Boston, it's a community that's driven by a lot of old, white men. And here I am as a female, a woman of color, and there's fear about how do I make that transition from being in this really comfortable, incubated environment of a lab and research environment into the industry. And so as I was going through that journey, I will say I made two, I would say, moves on my part that I think was extremely useful and helpful in my own professional journey. Number one, identify the right sponsorship. I found mentors along the way that helped me give me the right tools and help me opportunities to navigate in a world that I was not familiar with. That sponsorship, that advocacy is important. Now, back in the early 2000s when I started, I actually identified white male sponsors. For me at that time, it was, they may be able to help me open up the doors. They may be able to help me identify ways to navigate in a world that I'm not familiar with. And so that might have been the right thing to do at the time, but then I quickly realized I needed to find additional sponsors. I needed to find people that looked like me, that was going through my journey. And so during the course of my career, I had the opportunity to work in large organizations, small organizations, starting to take increasingly level of responsibilities. I started to learn how to even look at bank balance, the P&L sheets, how to look at profit loss statements, how to start making decisions on it. These are things that I never learned while I was in college. And I was lucky to be able to I was given some opportunities to be able to learn, fail, get myself back up, and then start to course correct. But the ecosystem of sponsors or mentors and advocates became extremely helpful for me during my journey, to the point that it allowed me to take on bigger responsibilities, run organizations of 1 billion, 2 billion, a couple billion, and thousands of people. But that took time, because while I knew that I had the right core competency technical skill sets, it was the soft skills that I was looking to build, the interpersonal skills, the grit, the hustle, not to stop because you're going to fail along the way. You got to pick yourself back up and be able to motivate, course correct, and then keep carrying forward. And as I think about my own journey, I reflect on bringing people into organizations. So as we look to hire folks from colleges or other institutions, we have now hiring practices that allow us to look at not just the technical or the IQ, but also the EQ. How are the individual's social skills? How are the individual's ability to navigate during difficult times? Can they collaborate? Can they work in a team environment? Can they use the thought process that they're able to build during college or other academic environments to be able to take what they've learned and put it in practical day-to-day real-life situations? And so as I think about how do I bring people along in their own journeys, particularly diverse talent, females, people of color, it's important for me to be able to give that environment for people to thrive and grow, but also start to create and help them create the right network of sponsorship to give them the more confidence and the ability to make mistakes, try again, and thrive and grow. And so I've been on the service side of my career, really looking at ways to develop products, services, and solutions, and build the stories and be able to sell those products and services into different stakeholders in the healthcare ecosystem. And the one thing that I will say, for me particularly, that I've learned along the way, it's about, number one, identifying that vision. Second is about conviction on that vision. Because you all know, There's a lot of people that have great ideas. How do you put pen to paper on those ideas and to be able to execute is a critical piece. And so one of the things I learned along the way was to learn how to make sure that if I had those great ideas, how do I execute against them? How do I tell that right story that people will buy into that vision, rally behind you, and be able to support you? Once you have the vision, once you have that story, then it's unleashing the power of your organization to be able to help you execute and get to where you need to get to the end. And so that is the framework that I've been using through the course of my journey, and it's really been based on folks that I have been working with as my mentors, peers, or others in the industry to kind of help support my growth. And so after being in large organizations for almost 15 years, I decided to venture out and do a startup. That, for me, was probably the scariest because I've never been exposed or done anything in a startup. But I knew that if you used your common sense, your academic training, and the notion of just EQ, that grit, that hustle, it would be enough for me to be able to carry forward in a startup focused on technology. And I've never been exposed to technology. Keep in mind, I've always been in biology. But here I was asked to take over a company that was purely focused on delivering tech solutions to customers. And so, did I learn along the way? Absolutely. Did I teach myself? Absolutely. Did I surround myself around people that understood the space, that would give me the advice, guidance, and mentorship? Absolutely, because you don't stop learning, even after you leave the hallways here at U of M. And so, we had a great ride, sold the company after 3 years. I learned how to source for funding, beg, borrow, and steal in terms of being smart and lean, coming from big organizations where you have a plethora of resources I was used to at my disposal. Here I am in a 20-person company. I had to be frugal, and I had to learn a different way of thinking and a different way of operating. But I go back to some of the core EQ skill set as just being constantly hustling, constantly learning, and constantly leveraging the network that you create over the years to help support that growth. We sold the company, and then while I was in the middle of a sale, as Eric mentioned, I joined Walgreens back in 2021. At the time, the organization had announced the move into healthcare. And for those that you don't know, Walgreens is a 120-year-old company. It has been focused on retail pharmacy. We have 9,000 stores and pharmacies across the U.S. We have, obviously, a number here in Ann Arbor and in Michigan. In fact, I think I'm speaking here at the Walgreens Drama Center. But as you all know, technology has been disrupting the industry to a point that it has been decimating the core services of a retail pharmacy prescription, because you've got Amazon, you've got others that are doing mail order delivery or finding electronic mechanisms to deliver product to consumers and patients. And so the idea was, how do we transform a massive organization, an old organization like a Walgreens that's about 120 years old, into more an innovative organization focused in healthcare? We are one of the most distributed models in terms of footprint, given the size and the scale. 78% of the US population is within 5 miles of a Walgreens. And we service roughly about 120 million lives that come into our stores and pharmacies around every day. The idea was to take this organization and take what Charles Walgreens Sr., who had built 120 years ago, still being family-oriented, still being focused on customer service, but how do we tech enable it? How do we make sure that we keep what Charles Walgreens created, but still be able to meet what's happening in today's world. And so today, what you're seeing in the last 2 years, we have completely disrupted our business model. We have spent about $16 billion in different assets focused in primary care, specialty health, and home health care. The idea is that we brought assets to help build the healthcare continuum and start to deliver healthcare services more locally. What does that mean? We've got 250 stores today across the US where you can go in and you can get screening, diagnostic, and phlebotomy services. So if you're not familiar with the healthcare ecosystem, you all probably understand that there's a huge shortage in physicians, nurses, and other healthcare professionals. Just take a look at your own selves when you're trying to schedule your own appointment to see a doctor. It takes forever to get in. And that's if you have insurance. But imagine the lion's share of this nation that still are not covered. They're not seeing healthcare professionals. They're not looking at themselves to help achieve better health outcomes. They're living day to day. So we've decided to take our footprint and start to deliver healthcare more locally so we can start to close care gaps. We want to make healthcare accessible for everyone. So here's an example of taking a business model that was created 100 years ago, leveraging the footprint, leveraging the infrastructure in such a way, and start to convert it so that it can support the gaps that exist in our nation. And so what you see here today are just simply the statistics of, what we're doing with some of our local Walgreens. Here in Michigan, we hope to convert a couple locations next year, so you'll start to see some of the new formats. You'll be able to go into private health rooms where you'll be met with clinicians. Could be a pharmacist, it could be a nurse, or a physician provider that will be able to provide you healthcare services. Just to back up a little bit, as we were thinking about our own transformation, it was centered around the why. And as I reflect on my own journey, whether it's working in big organizations and leading large organizations or startups, it always has to start with your why. Because your why is going to fuel your vision. It fuels the story that you create and you tell, whether it's to your customers, investors, or others that are going to want to listen to you and advocate for you. And that why then becomes how you unleash your organization, your peers, or others around you to be able to execute against that vision. And so for us at Walgreens, we were in a room filled with a ton of smart people. We hired consultants to help us figure out what that path was going to look like. And we centered around our why. And again, our why was to make healthcare more accessible for people across the nation. And so what you see here on this slide reflects all the different assets that we acquired as part of this $16 billion investment that we've made to help us unlock and delivering services into our communities. So again, it's centered around our why of who we are. We haven't dismantled our core services, which is our pharmacy business. You still can go to a local Walgreens and pick up your prescription. That's still there. But we've simply built on to the core set of services as we start to move and transform into the healthcare ecosystem. Our focus is community. We want to make sure that we're serving the communities that are in need of support. We're serving the people that are in need of healthcare, and we continue to keep our patients top of mind and our consumers top of mind. So as you start to go into a Walgreens, you're going to start to see more digital engagement. If you go to any of your retail pharmacies today, I'm sure you get those text messages that said, hey, listen, you haven't picked up your cold medicine or a package of gum or something that you've picked up. We're using AI, we're using technology. Again, we're bringing what's happening in the ecosystem, the innovative trends that we're seeing around technology, and we're using that to help disrupt a business model that's been baked for over 100 years so that we can bring more services and more good into the communities that we serve. I've spoken about what we do, but how we do it. And I think this is important. We're a 300,000 people company. It's huge. And it's not easy oftentimes to be able to execute and transform a massive organization that has been rooted and doing things the old ways. There's a huge cultural shift that's taking place. And part of it is, it's to also bring people that have the right skill sets, not just from an IQ perspective, but EQ. Are they prepared to be able to support this transformation? Are they prepared to provide value? Are they prepared to sit down, roll up the sleeves, and help drive solutions that will get to the point that we want to get to? Are we there yet? No. We just started 2 years ago, and we know it's a journey. And so in the last 2 years, we have been looking out to the industry. We have been bringing leaders. We've been bringing folks from different colleges for internships as we bring in new thoughts, ideas, to help support us in this transformation. Again, our why, our mission, everyone deserves equitable access to health care in the communities that we serve. So what's my role in all of this? So I was asked to come in and build a brand new startup within this massive organization that was undergoing this massive change. And I remember having this conversation with our CEO and the board, and I said, why do you want to get into clinical trials? I spent a lion's share of my career in medical research, developing services, developing products, focused on the drug development life cycle. What makes Walgreens think they have a right to win? So before I even took the job, I asked the tough questions, because this would be a commitment and an investment that would need to be made if this was going to be launched and be a long-term entity for the company. And the answer that I got was, well, we don't know much about it. We just know that we have all these assets. We're getting into healthcare. You do what you need to do to bring this to fruition. And to me, it was exciting, but fearful at the same time, because I thought, oh my gosh, I'm literally going to be starting from scratch in a massive organization. How the heck are you going to be able to get anything done in a 300,000 people organization? The good news is, you've got the resources, potentially, you've got the funding, but how do you execute? So I signed up and said, yep, count me in. It was going to be a challenge, probably one of the biggest challenges in my career. And I came to the organization, and I used some of the old framework that I've used in other organizations. I spent the first 2-3 months trying to understand what we had and what we didn't have. Beyond just my executive committee peers, I decided to do one-on-ones across the organization. In 3 months, I completed over 222 one-on-ones. Talking to people across the organization to hear firsthand what was working, what was not working as we were going through that change, as they were going through that change. Because I was going to use that information to help me architect the blueprint of this organization. I wanted to hear the employee's voice. And so after I got some good feedback, insights of what was happening, then it was time to build out the business plan. How do we leverage the infrastructure the people, the horsepower, the brand, and the trust that Walgreens has in the communities? How do we unleash that to create my why, create the story, and get advocacy? Now, keep in mind, just because the board had given the okay for this to go, I still had to figure out how to launch and create the internal advocacy to be able to execute, because these are not my assets. These are part of a larger organization's assets and resources. So I built the story. For those that understand clinical trials, if you think about medication that you might be taking today, it is highly tested. It goes through a rigorous process. Can take anywhere from 10 to 13 years before a new product gets into the pharmacies to be dispensed for all of us to pick up. And it goes through a process to protect the research integrity, the patient safety, but also making sure that what's out there today and what you and I take is something that will improve the health outcomes. But it's a long-winded process. If you think about the COVID-19 pandemic, how quick we were able to get the vaccines out to everybody, we shortchanged that entire drug development process because people all over the world got together and figured out how best to make this and get the approvals, get the safety and efficacy data and get it all through the system. It was amazing. So knowing the challenges that I have faced in this industry over my 15, 20 years, what do I do differently? Because I have to create a B2B model. This thing has to sell to customers. And so I identified all the gaps that were happening in the industry, created the why, that we needed clinical trials to be accessible for everybody. Less than 5% of this nation participates in medical research. Those that participate, 75% are Caucasian. That means if you pick up a drug today, your Black, brown counterparts are having different adverse events or variations than perhaps your Caucasian peers. That's a problem. And so the why quickly became, we at Walgreens have a right to win. We can bring research, clinical trials into all of our stores to make it accessible, to make it convenient, and make it a care option, particularly if people are on certain therapies that are not helping to improve their outcomes. Created the why, went across the organization, our pharmacy operations, our retail operations, our legal teams, compliance teams, you name it. I needed to get them to be advocates for this story because I needed to rely on their resources and their teams to be able to execute. Got the advocacy. Within 8 months of me joining, we launched the business. Now, from what I understand from the board, this is the fastest that anything has been able to launch in a large organization, and people have always asked how and why. It's because, again, I gained the internal advocacy. We hit the marketplace last year, June. We had distinct set of services that we were selling. We made it simple. I'm not going to go through the slide because there's probably a lot of technical jargon that may or may not be familiar to you all, but we said, what are the services that we can create that are simple, easy for customers to buy, and help us to build a body of evidence for a business that's just starting up and to be able to move forward. So we created 3 service lines. We said our pharmaceutical companies are going to be our targets. We said healthcare systems will be also our partners, and we targeted a couple payers or insurance companies. I hired a leadership team, and it was important for me to find people, again, that had not just the IQ, but the EQ, because it's a startup. I needed folks that exhibited behaviors of collaboration, teamwork, grit, hustle, prepared to fail, and then to be able to storytell around our why. Each of the leaders were brand new, so there was some storming and forming that was happening along the way. But in the last year of this business launch, it's been incredible to see in terms of launch performance. We've, in 1 year, gotten $50 million in revenue in short order. Not bad for a startup. But what's more important, that this is now having a transformation in the industry. We have a seat at the White House. We have the seat at the FDA, because we're trying to push change, not only within the Walgreens retail ecosystem, but we want policymakers to make changes in reimbursement pathways so medications become accessible for everybody. We're looking to expand the role of the pharmacist to be able to dispense health care, and not just with the physicians, especially those that are PharmDs. We are now working with members of the White House that are saying, if there's a next pandemic, how do we make sure retail pharmacy becomes essential to care? When everything was shut down, you all know during the COVID-19 pandemic, retail pharmacies were open up and people were getting shots in the arms there, not at doctor's offices. So my point is, we've taken this why, we've taken our mission, not just to help support our own organization, but we're taking it one step further as we transform the industry. And use this as a mechanism to help people that actually need healthcare. So the business model that we've created is one of purpose-driven, positive impact, and makes money. And so I think, if anything, I reflect on this journey so far. It's been a fantastic ride. We're always learning. I'm still learning along the way. But I will say that as I reflect on my days here at Ann Arbor and where I am today, it's been a great blessing and a privilege, but it's not been linear. It's been a non-traditional path. And part of, for me, it was accepting that I don't have to go straight, because that's what I initially planned. But again, it was back to my sponsorship and the allyship. The allyship is around the peers and the network that you create to help you unlock as you go through this journey. And for me, that's been one of my lessons learned as I've gone through my journey. And as we continue to push this healthcare transformation within Walgreens and the clinical trials business at Walgreens, we're constantly learning. And there are days when it's really hard, but there's opportunities to be able to course correct. And we're bringing in talent from the industry to help support us in this growth. So with that, Eric, I'll go ahead and pause and take questions.
Okay, so much to dive into and to pick apart there. One of the things I want to bring up, because I'm sitting there listening and thinking, okay, this is great, they're transforming it, they're really kind of thinking ahead of the curve on things, but you weren't the only industry player to also do that. Your competitor, CVS, was doing this as well, and then last year, after 2 years, they shut down their clinical trial business. Talk to us about what Walgreens sees that CVS does not.
It's a great question. The whole healthcare transformation journey has been something that all the retail pharmacy players are taking on. So, as Eric mentioned, CVS is in the space, Kroger and Walmart, because again, they're leveraging their distributed networks and models to be able to, operate in a $4 trillion market. That's what healthcare is all about. And so, for clinical trials specifically, it's a shame that CVS decided to prematurely shut down, because it's new. It's a new business model. It's one that everybody is waiting to see the impact. And as I talked, we've hired a number of folks from CVS into the organization, because obviously, they've done good work, so might as well take some of that talent. But I asked the same question. I said, what happened here? And as they've come into my organization, they said, the difference is you have advocacy at the board level. You have advocacy within the other parts of this organization that are helping to unlock Within CVS, they were struggling, they were fighting amongst each other because it's finite resources. When you're in large organizations and you've got to be able to tap into other people's resources, especially if they're not yours, it can be a challenge. And so I think one of the pieces that we've picked up is that we have created the right network of folks within the organization that are helping to support us to execute against the model.
So you've got an executive culture that's supportive of it. You've got 9,000 stores as a footprint to go distribute through, distribution channels. You've got access to 300 million medical records, electronic medical records through the partnerships that you have. You have 80% of the population in the country that's living within 5 miles of a Walgreens. What don't you have? What are you missing that you really need?
It's a good question. We're in front of investors all the time. And look, even for my business, it's about body of evidence, right? When you create a new business model and you're out there today, the first thing people are going to be asking, show me the proof that this thing works. And so we are out there today distributing case studies, proof points that the operating model is working. And so we're early days. I think, from a asset perspective, we have everything that we need to be able to execute and deliver against this massive vision. But it's all about wait and see, and it's execution. The earlier point that I made, a lot of people have great visions, but they struggle to be able to execute and move forward. And that's why we oftentimes see a lot of startups, they fail.
So to that point, in the wait and see mentality, you've got a company that has been around for a long time. To ask the tough question, when it keeps you up at night and you think about how long that waiting period is, that you'll have the patience of the board or the patience of the company, what do you think that timeline looks like?
It's a short timeline when you're a publicly traded company. Look, for me in the clinical trials business, we've made it very clear that we have 1 year. I've put a 1-year time frame for the organization to say we've got to deliver on these proof points. We've got to not only show financial momentum, we've got to show the impact to the patients and the impact that we have on the industry. And so are we hustling? Absolutely. And I think that's, that window is short, particularly when you're in a publicly traded company.
You can imagine. To that point about your hustling, when you're talking about entering the company and conducting, what'd you say, 230 interviews?
Yeah.
Internally, it's just remarkable. We talk all the time to students who have startups and who have ideas about the importance of conducting vast customer discovery to understand the market. Give the students who are interested in becoming disruptors in their career and kind of shaking up an industry in this way, what are the other granular tips that you would give them in that same kind of thought process? What can they do, or how can they approach that desire?
Yeah, listen, beyond just understanding what's happening within your own ecosystem, whether it's your peers or the people that are working for you, it's understanding how the consumers are thinking and buying the services. That's the other thing. Before we launched the business, it was to understand how the consumers are buying today's services, healthcare services. What do they want to see? Because then you identify those gaps. And so as I was trying to create what the right business model would be within a Walgreens, I didn't want to become a Me Too, because what's the point? You're not going to be able to then, create the value proposition for your own business, and then you're not going to be able to see the revenue that you want to see. So it was trying to identify what those gaps were, and then create the service footprint and the business model around those gaps. And the internal conversations was around, how are we going to execute against this? And so just listening to all the good, bad, and ugly stories was actually quite helpful for me as I started to architect that business model.
And I keep hearing this theme of storytelling in what you're doing, and being internally or externally, the need to otherwise continuously feed the narrative around what's going on. The narrative that clinical trials are so homogenous was something I was completely ignorant to, and I hope that I'm alone in that, and I'm glad that I kind of got an education in reading this. The trending hashtag I've seen on this is 3 not 30. Talk to us and explain what that means.
Yeah, so Obviously the notion of people participating, particularly, minority patient populations participating in clinical research is a huge issue for the nation, particularly as we look at the mortality rates across different disease areas. And so the campaign that we're on in the next 3 years, we want more investments that are devoted to dealing with some of the systemic barriers that exist in communities, particularly communities of color or communities that are in underserved populations where they don't have access to health care. So we want investments, whether it's using physical footprints like a Walgreens, or identifying reimbursement pathways that allow patients to be able to get the coverage. As I think about the communities that I'm, as I go through and do all the traveling, areas in the Deep South and the rural parts of America, believe it or not, it's hard. When I start to talk about, hey, listen, what's your healthcare journey look like? How often do you see your primary care doc? Most people tell me, what are you talking about? I'm trying to get food on the table. And then I try to bring technological advances into our stores, and the questions I get is, well, my broadband access is free after 6 o'clock. Are you going to keep your stores and your facilities open to be able to have me come in off hours? Or I don't have childcare, kind of thing. So those are the real world issues that we're dealing with. So part of this campaign is, in the next 3 years, is to be able to muster up the investments, the assets to be able to support these communities that don't have access to health care, which is why I'm front and center in Washington, D.C., and the agency to start to rally behind that support.
That's outstanding. And I'll throw out a quick factoid, but first I want to call on, we have time for like one question. So I want to hear who has the most amazing question out there. Throw your hands up. Lisa's going to come over to you. The factoid about that is the 3, not 30. The 30 part about that is it was 30 years ago that Congress required and passed a bill requiring women to be considered as part of clinical trials, which you would have assumed was always there, but completely was not. So we have a question, I think, up front here. Great.
Yeah. Well, first of all, thank you so much for the presentation, and thank you so much for the insights. I know you've worked at a variety of companies. You've worked at larger structured corporations and smaller companies where you potentially probably took on more responsibilities. Where do you think you learned the most to better gear toward running a startup?
Great question. I would say a lot of my learnings came from big organizations, and I'll tell you why. The behaviors that you start to learn about teamwork, the hustling and the negotiating, in a very highly matrixed environment, certainly makes you grow up. And look, many organizations are highly political, and it's not for everybody. But I will tell you, I learned a lot about myself, how much I could push, and finesse some of the behavioral skill sets that perhaps I didn't learn, in an incubated environment on campus. And I will tell you, a lot of colleagues along the way said, look, big company's not for me. I want to do the startup. But using the lessons learned from big companies can certainly enable you to be a better leader as you start to lead in a startup environment for your teams to rally behind you and execute against the vision that you have for your startup.
And we're witness here today to the storytelling ability it's given you. Thank you so much for joining us. Really appreciate that. Have a great weekend, students.
Thanks, guys.